Hi everybody, Thomas from Precision Physical Therapy and Sports Rehab, just here to talk to you today about shock absorption and ways that you can assess how you absorb shock and how you can improve the way that you absorb shock. So when I'm talking about shock absorption, I'm talking about the ground moving up into the body. So the first place we need to look at are the ankles. Are our ankles moving the way we want them to? Research shows that if we have decreased range of motion in the ankles in dorsiflexion, which is the motion of your toes coming up towards your shin, that's going to place us at higher risk for heel pain, higher risk for ankle sprains, higher risk for patellar stuff, knee stuff. So I want to show you how you can assess that and correct that if that is the case. So all you need is a wall and a ruler or a tape measure or something where you can measure your range of motion. And this has been, research has shown that this has been a reliable way to measure your range of motion. So what you want to do is take your shoe off, get over to a wall, and I already have my ruler placed here so I can see how far from the wall that I'm going to be. Get your big toe lined up 4 inches or 10 centimeters. Just start with one of those standardized measurements. And then you want to see if your knee can travel far enough to touch the wall. Okay? A couple things you need to pay attention to. If your heel lifts up, okay? If your heel lifts up or your knee travels inward. What I mean by that is if your knee travels inward of the second toe. So make sure that your knee stays over the second toe. Okay? So once you have that measure, then you're clear. Now if you have to scoot your toe up towards the wall further, less than 4 inches or less than 10 centimeters, or it's different than the other side, those would be a positive test for a limited range of motion. Okay, so how are you going to correct that? We've got tons of different ways to correct that. I'll show you a couple of quick ways that you can do that. This is a foam roller. This is a little fancy foam roller. It's got kind of a PVC pipe in the middle, so it's a little bit firmer, a little bit stiffer. And I'm going to use that to massage or release or relax these muscle tissues on the back of the calf, or the back of this part of the leg. Research has kind of shown, just this last year a study came out that showed people who foam rolled their quadricep muscle, I think it was for 2 minutes, gained a good amount or a significant amount of range of motion, didn't lose any strength in that associated muscle. So how you use a foam roller, get it placed underneath kind of where your Achilles tendon is. You have to support your body weight with your hands and then just roll back and forth. When you roll back and forth, try to get into the outer edge, the back edge, the inside edge. Get this whole kind of, I guess, meat on the back of the leg to kind of improve the blood flow. Talked about that. Decreasing restrictions, fascial restrictions in that area. The other thing you can use, this is a stick that we use here. It's designed specifically to massage muscles, but if you have something at home, even something that you roll out dough with, a rolling pin would work quite well too. The way that I like to use that is get the foot up on a bench or a chair or something, get that pressure, push it into the muscle, roll up and down. Okay. You might notice some tender spots with the foam roll, which is a little bit more pressure. You might notice some tender spots. You might notice some spots that aren't quite as tender. So try to focus your attention and energy on those tender spots. That usually gives you a little more bang for your buck for releasing the tight spots in the muscles. So anyway, all right, hope you guys enjoyed the little quick lesson and have a good day.